Statins are lipid-lowering medications that are used in treatment of hyperlipidemia and atherosclerosis. And examples of these medications include the atorvastatin, rosuvastatin, simvastatin, and fluvastatin. And here we will talk about what these medications do to the body. So statins are taken orally, and they would go through the mouth and then into the pharynx, into the esophagus, and from the esophagus they would go through the stomach, and from the stomach into the intestine, where they get absorbed into the blood. And after they get absorbed into the blood, then they would get distributed by the blood into the body tissues. Now, after distribution, some of the statin dose would reach into the liver, where it works to reduce the cholesterol synthesis in the liver. Now, that is achieved by inhibiting the enzyme, which is the HMG coenzyme A reductase. This enzyme is involved in the production of the cholesterol, so once it is inhibited, there is less cholesterol synthesis and there is less lipid synthesis. So as a result, we have lower total cholesterol and we have lower LDL levels, and both of the cholesterol and the LDL are the bad lipids. And at the same time, we have increase in the synthesis of the HDL, which is considered as the good lipid. Now, after that, the statins would get metabolized by the liver, by the CYP enzymes, and they would get excreted through the urine and bile. Now, statins are usually well tolerated by most people, but sometimes they may lead to side effects. And these side effects include myopathy, and myopathy is muscle damage which manifests as muscle pain or weakness, and it is reversed by stopping the medication. And statins may also lead to hepatotoxicity, which is caused by the hepatocellular liver damage that is done by the statins. And this manifests as elevations in the liver enzymes, and it also manifests as weakness and fatigue, and it also manifests as jaundice, which is yellowish discoloration of the skin and mucous membranes, and dark colored urine. And statin therapy is also associated with increased risk of developing a new onset diabetes. And statins are rarely associated with cognitive dysfunction.